This is Sarah. Professionally, Sarah is the manager of an aged care facility and coordinates a team of 59 domestic employees. Sarah comes from a corporate background and believes that strong managerial practices are essential for productivity. She recently implemented new policies and procedures to improve staff proficiency and decrease expenditure of cleaning products. Privately, Sarah lives with her partner, who is also in a managerial position. They are financially secure and enjoy the benefits of being able to afford regular holidays and an active social life. 3 weeks ago, Sarah had to meet with a staff member, Ray. Ray, who up until now has been an exemplary employee. Though for the past month, Ray's had numerous citations of lateness, errors in performance, and conflict with other team members. Professionally, Ray's an architect, though now works long hours for minimum wage. Privately, Ray's been living in Australia for 2 years and resides with his wife, 3 children, one of whom has a chronic disabling health issue, and his elderly mother. Ray's wife recently lost her job as a line production attendant for a manufacturer of cleaning products. In their meeting, Sarah listened to Ray and heard that he was experiencing stress outside of work, however advised him that to keep his job, it's best to leave these problems at home. She also gave Ray the number for their Employees Assistance Program provider, their EAP, and explained that they could help him with his problems and to keep his job secure. Sarah documented the meeting and her actions, and since that meeting, Sarah has not received any complaints about Ray's work performance, and on the few times she has seen him, they've exchanged smiles, all of this indicating to Sarah that the issue was resolved. Yesterday morning, Sarah received a phone call telling her that Ray was in hospital. Ray had attempted suicide. Emotional and unable to concentrate, Sarah left work early yesterday, and like Ray, she is not at work today. Sarah and Ray's situation is not an isolated event. Workplace mental health is a major issue in Australia and across the globe. In the decade to 2011, an estimated 3,800 Australians died by work-related suicide. That is the human cost. International economic predictions for the period between 2011 to 2030 say mental health issues will cost workplaces in excess of $16.3 trillion. Further facts tell us that 20% of the population will experience a mental health issue. Depression is the largest cause of disability worldwide. Working conditions are a determinant of mental health stability. Minority groups in the workplace have a higher chance of experiencing a mental health issue. 12 million days of business productivity are lost each year in Australian workforce as a result of mental health issues. Australian policy does appear to be making concerted efforts to help increase productivity and reduce mental health issues. However, efforts are reflective of changes in Australian policy towards mental health issues, where there has been a shift in discourse from a perspective of social equity and justice to that of economic profit and managerial practices. The EAP is a modern example of practice demonstrating current discourse. It was theoretically framed to address and reduce mental health issues in the workplace, as well as support wellbeing issues that adversely affect workplace performance. Unfortunately, the EAP itself is not productive. There has been an 11% annual rise in the demand for Medicare provision of mental health services, and there is a growing body of evidence regarding the issue of workplace presenteeism and absenteeism. Effectively, the cost of services related to mental health issues in the workforce is over 11 billion Australian dollars. These facts disparaging discourse and practice are not going completely unnoticed. A theoretical approach of invest to save, which highlights the need for a collaborative approach between past and current discourse. Alliances of organisational peak bodies observe a current push for the sharing of power between government and organisations, for them to work together to support Australian workers beyond the workplace and into areas of health, education, family and housing. Furthermore, research supports alliances and investment into mental health initiatives, postulating a financial return on investment to be $2.30 for every $1 spent, thus making good economic sense to invest in change. Imagine how differently Sarah and Ray's situation may have resulted if their organisational culture was different. Imagine if Sarah and Ray's organisation provided professional and personal training to staff, developing skills of understanding and support for mental health and cultural diversity. Imagine how different our communities, our Australian society might be if government implemented initiatives for employers to offer such training. It can be imagined that organisations who value social sustainability policies and practices for their stakeholders and the wider community will become vital instruments in the solution of sustaining mentally healthy workplace environments.